Hey guys, welcome to the Hidden Spoons podcast. I am your host Ishmael.
And I'm Tim.
And today we want to share with you guys a really special episode. It is our first episode and it's with Dan Stewart. And we talked about a lot of interesting things with Dan. We talked a lot about how fitness plays a big role in his journey. We talked about how music played a big role in his journey.
We talked about he started out in engineering, how he ended up in nursing, and everything in between.
Yeah, we even touched a little bit on his dating life and how dating worked out for him with his illness. We're excited to share it with you and enjoy. Hey everyone, so welcome to the Hidden Spoons podcast. Today our guest is Dan Stewart. Dan is a boxing and yoga instructor. He has had IBD since he was 14. We're going to be talking to Dan about what life's been like for him in this last 14 years with his journey. Obviously, in the last 14 years, you've had a lot of stress that you've had to deal with, and what's the main thing that you've done, or what's been the journey to try and figure out how to manage that stress? Because obviously you didn't get it right away.
I actually think that that's kind of my entire story of IBD, ulcerative colitis, is stress management.
Yeah.
So yeah, I got diagnosed when I was 14, but it was a pretty typical progression of colitis until I was about 20. And that's when I had a really turbulent phase of colitis. And that's when stress management really became a significant issue and something that I really needed to address. Because I found that my studies at university and just life in general was becoming very stressful and I wasn't coping with it well. And that not being able to cope with it was aggravating my colitis a lot. Mm. So at the time, and like you said, I've had this now most of my life. So stress management as a teenager and as a young adult looks very different than now when I'm 28. So at the time when I had my last, it was hard to recognize what aspects of life could change and what things I could control with stress management, and being able to get rid of certain aspects of life that were contributing to my stress versus being able to handle other aspects of life that I couldn't necessarily get rid of, but I could change my approach to. Mm-hmm. So that balance between recognizing what you can purge or change and actively fix versus how you yourself can change your approach to something that maybe externally can't be changed, but you can change your dynamic with it. That has been my approach to stress management that I learned in my early 20s and I'm still applying now. Kind of long-winded way of saying that stress management is really important.
100%.
Yeah, and a really big part of my personal and professional life, right? You mentioned boxing and yoga. So yoga was my kind of my first thing to work on stress management as an external thing that I went into and was like, okay, this is a good tool that I can use. And it really was and is something that I attribute to being able to cope with stress and anxiety and everything to do with chronic illness and the whole thing.
Yeah. You enjoy fitness, you enjoy yoga, so you just made a point of making those an active part of your life instead of just not, and keep knowing that you maybe one day would maybe like to do something that you enjoy.
Oh yeah, that's a big thing too. Yeah. And kind of what I was saying before about recognizing what you can get rid of or change. I was in a profession or kind of a trajectory that I was not into at all and was significantly contributing to my stress and anxiety. So I actively made the decision to change it, and I do not have anything to do with that previous trajectory. So I was in mechanical engineering, graduated, was like, oh my God, am I actually going to spend my whole life being an engineer?
After the fact.
And
do it.
I was like, I don't want to, so I'm not gonna. I don't want to. So ended engineering and really glad I finished it. It was a good program, and I'm grateful for the things that I've learned, both academically and in my own journey through engineering, what I've learned about myself by doing that. Mm-hmm. But then also now being able to look back and say, holy shit, if I hadn't taken that left instead of the right, where would I be? And I really don't think I would be in a good spot if I'd stuck with something that was just not for me.
So how quickly after you finished mechanical engineering did you realize it wasn't for you? And how quickly thereafter did you move into working in the medical profession?
Yeah, so I did a 5-year engineering degree, and we did an internship in the middle. So I worked for a company that, it was a good company. It was the whole spectrum of engineering. I got to see a bit of mechanical, civil, chemical, the whole thing. And honestly, after a couple weeks of that internship, I was like, no. There was no sense of community in what I was doing, right? Like you don't go to your colleagues for, for drinks after work or just help solve a problem about your life. It's like, hey, did you get the specs for this part? And yeah, it was not good.
That sounds, even like the tone of that.
Yeah,
it's kind of like a little bit of my soul just
shriveled
up a bit.
Out,
did you
doesn't
get
it?
the specs for that?
Yeah.
Thingamajig for the project.
Thingamajig.
So I had a spreadsheet going throughout my whole internship of the number of days left.
Yeah.
And then my friend and I both hated he was at a different one, but he also had a spreadsheet going, and he got me onto this idea, and then made like this like calculation to figure out like the percentage of happiness that we had left. And it was every day that we were closer to being done, we were that much more happy.
Oh my gosh.
So like 9 months in, we were like, oh, we're 87% happy again.
you guys engineered your way
We did.
out of engineering.
See, that's what I mean.
That
right?
was the
like,
final project.
I've learned a lot of good stuff from engineering.
Yeah.
I love me some Excel documents.
Yeah,
I
bet you quick key.
Oh yeah,
Control C, Control V.
Oh,
That's my max.
Control C, Control V. That was day one.
I know. That's when I knew engineering wasn't
yeah. No, so I learned really, really early on that it wasn't for me. And so going back for my final year of engineering was challenging because I knew that wasn't what I was going to be doing. But it was also kind of liberating to go back as a choice and to finish something by choice rather than by obligation. Like no one was making me go back. My parents were not pressuring me at all to finish this or to go be an engineer, right? It was, okay, I've made it through 4 years. I want to finish this so that I've finished it. And then let's see what happens after the fact. So after I graduated, I worked for 3 years in retail and loved it. I worked at Lululemon and it was the best nearly 4 years ever. And because I was working there, I was able to start teaching. So that's where yoga started to come in. I started teaching yoga like the month after I graduated engineering, and then was teaching pretty full time, like 7, 8, 9, 10 classes a week. So that was just a few years of just living, really, like driving around, teaching some yoga classes, going to sell pants, like very, very low stress lifestyle for a while.
Yeah.
And it was shocking because it showed me how much stress was about how you're living your life.
Yeah.
It was very nice to just be out in the real world, not doing something that I despised.
So in that journey, when did you realize that you wanted to go into nursing school?
I'll tell you, I know the exact moment actually.
Yeah.
The decision to go into nursing school, I know the exact time, but my mom's a nurse and I have always loved medicine. Being diagnosed young, I've been exposed to medicine through my whole life. And even before colitis, I had asthma and all sorts of stuff. So I've always kind of been in the medical system as a patient. Mm-hmm. And I've really loved it. I've loved the complexity of it. I've loved how dynamic it is with who you're connecting with as a patient, also as a provider. The whole thing I've loved since I can remember. And coming out of high school, I actually wanted to be a physician, but I didn't want to go into biology or a sciences route through university. So I chose to do engineering instead, thinking, oh, well, I'll just do really well and maybe go into med school after.
Keep all the doors open.
Keep all the doors open for sure. Turns out that if you don't love what you're doing, you don't end up doing very well at it. So I was very mediocre in engineering school. So it kind of took medicine off the table. Was working for Lululemon, and like I said, I love working for Lululemon. I loved it in the past. I still love the company now. I think it was fantastic and very formative for where I am now. It's been a really important journey. However, there was a day where I was sitting in a pop-up location. It was just me. It was a hot summer's day, and there was no air conditioning, and it was in a shipping container, so like a steel shipping container pop-up situation. And I was sitting there, and I had like this tiny little stationary fan just kind of oscillating back and forth. And I just was like, what am I doing? Like, what is going on right now? I'm sitting in a box, sweating, trying to sell shorts. And I was like, I don't want to do this. I don't want to do this for forever. You know, maybe in a few years I'm a store manager. And then what's after that? Maybe it's a regional manager. You know, you can progress, of course. But then I was like, okay, so what do I really want to do? And like I said, I've always loved medicine and I've always loved nursing. So that day in the box, I enrolled for the anatomy and physiology course that was prerequisite, and then did spring, summer, and then applied to nursing and got in. That was a long journey, and a decision that took a year to pan out. But I'm just so grateful to everything. I'm so grateful that I had the opportunity to do that. I'm grateful that I had the flexibility as an entrepreneur to build my own schedule with teaching classes, because I still had to teach because I love to teach, but also that was about 40% of my income. So had to do that. And then it all kind of suddenly just happened, and started nursing. And yeah, I'm going to be done in a month, and it seems pretty crazy this feels like it's just been nonstop, like straight down a race course for the past few years, and it's suddenly coming out of the other end is pretty cool.
And mentally, how do you find the difference between when you were doing the engineering degree and you were like counting down the days?
Oh, sure, yeah.
Versus now and you're doing the nursing degree. Like, what's the how does that differ?
It's just so different. Like, it's hard to quantify. It's hard to say how different it is, because it's just night and day different. I love what I'm learning. I love what I'm doing. Mental health wise, stress wise, it's really amazing to see how you can cope with something that you love, and how your body has a much different buffer zone than coping with something that you're not into, coping with something that you really don't want to be coping with at all. Now with nursing, like, it is a lot, but my ability to cope with it is so much deeper. It is such a better reserve of coping skills for nursing compared to engineering. Yeah, it's been good. Yeah,
just really, like you had said initially, when you were telling us about your general feelings about engineering and where you didn't really like the environment, maybe you didn't see that was going to be the path for you, really being able to sit down and be like, okay, why am I feeling this way? I definitely struggle with being able to think, okay, I know I want to be here. I think I know how to get here. How do I start that process? Because kind of like the first step is like, which direction am I going in? And
yeah, my friends have been absolutely critical in my whole journey. Again, chronic illness, sexuality, the whole thing, critical. I could not be where I am without my friendships. And I'm an only child, so for me, my friends are my family that I've chosen, my siblings that I've chosen. So I've had the same 4 friends since I was like 15 years old growing up. So they have been the most important people in my journey, and coming to terms. Sorry,
they've seen it all.
Oh, they've seen everything. Yeah. Oh my God, yeah, yeah. But yeah, and so friendships, absolutely, and being candid with your friends and telling it how it is, and trying not to paint it so that you come off better, or tell the story so it favors your point of view. I really did try to talk to my friends about how I was feeling as objectively as I could, so that you can get honest feedback rather than the feedback that you're fishing for.
Yeah, I like the honest, like when you were saying before about getting that honest, objective feedback to real people who you know. I think is so, that kind of was just, I feel like that's just such an important overlooked thing, especially in the era of endless advice on the internet. You can follow, like, I feel this phenomenon of you can follow as many inspirational quote Instagram pages you want and have all then you start getting targeted ads for the best inspirational speakers in the world, but it's just nothing really hits it as hard as talking to a real person about something you really feel. I feel like people, I feel like that's super just hugely underestimated in terms of how it actually helps.
I feel like there's a good balance between having the conversations with the people that know you and then having a conversation with the people that understand what you've been going through too. Yeah. So like for you, was there any kind of pivotal moment where you found yourself amongst somebody else that had your illness that you felt a little bit more like connected to in that way, and you were able to share things that like other people maybe didn't necessarily understand?
I wish I had, but no, I didn't. I'll be very honest, and I've been in remission for quite a while. So I've been in remission for 7 years, coming on 8 years, which is like, thank God. But yeah, at the time when I last was dealing with a colitis flare, I didn't know anyone else that had colitis or even had an experience of a significant health issue. And I think that having someone to talk about that with would have been really, really beneficial for sure. I leaned on my friends, I leaned on my parents, and talking about things candidly is always something that I think is really helpful. But yeah, had I known someone that had gone through chronic illness or colitis or whatever it would have been, I think that would have been really helpful. Yeah. It's hard to talk about diarrhea with your friends.
It's so true. Yeah. And the thing is, like, sometimes when you do like open up to friends about some of the like things that are going on, and you can be like completely honest and vulnerable, and you'll be like, oh yeah, like if this happens, then like I'll probably like go into a flare up, and they're like, oh, like don't talk like that, and you're like, no, but that's like the reality of it. Like I'm not trying to be like self-deprecating, but like that's like the reality of having one of these illnesses, and I'm just being honest. But they go into like defense mode because they're not aware of it. But like if you talk to somebody who's been through it, they're like, oh yeah, like you got to be careful about that. Whereas, so
don't ruin your month. We got a big month coming up. And then there's the other side too, where it's like if you have bad flare, be like, no, like if I don't go to the washroom, I'll shit my pants. Yeah. And they're like, no. Yeah, like I have Taco Bell sometimes. I get it. Those burritos hit me. I'm like, I like literally can't not shit my pants. Cannot shit my pants. You could maybe not shit your pants if you get Taco Bell, but this is different. But it's like that weird. Yeah. Like it's just a weirder. It's a different thing.
Super different. That vibe, yes, for sure. Also, I found it so frustrating when I was like, I need a minute. I'm having debilitating cramps, and everyone's like, well, I get cramps. And I had lots of female friends, and they were like, oh, it's like a period cramp. You just have to push through. I'm like, literally, you don't know what you're talking about. I fully believe you. I'm sure childbirth hurts and periods hurt, but like, you just need to give me a second. Just give me a second, please. As I'm sweating.
I'm fighting off. Like,
the sweaty cramps are the worst.
Oh my God. Yeah. Oh my God.
Position, everyone's like,
Or just like the blind fear of like, what do I do? Like, where will I have to, like, what do I do?
The nearest bathroom?
Yeah, like sweat, cramps, like find a corner if you had to, like,
Yeah, I'd always just like go and have like the warmest bath ever, but then like run the risk of like being too like fatigued to get out of said tub. It's very humbling. Like, this is my grave now. Yeah, porcelain.
I live here.
So you've been in remission now, you said, for 8 years. And in remission, do you still experience like the cramping and like the bloating, or is it like kind of real secondary?
Cramping and bloating, no, thankfully. Types of bowel movements definitely are still colitis-y. Like, there's no other way to put it, right?
No, that's a lifelong relationship.
Right? And that's also something that I've learned for the 14 years since I've been diagnosed, what my bowel movements are like what my body is like through digestion, and how that kind of can change, and what's concerning versus what's just my normal. If you ever go into anywhere and they're like, oh, how many bowel movements do you have in a typical day? I'm like, well, like a few, but I have colitis and that's normal for me. They go, what do you mean is normal for you? What's normal for you? And you're like, please, I know what's normal for me.
Calm down.
I know. Yeah, so the cramping and bloating, no. And I'm really, really fortunate, and I've never had this throughout my whole trajectory of colitis, but I don't have to worry about what I eat. I don't have to avoid any foods, which is so nice because I like a lot of foods. But I will say that is also a little frustrating because it would be great if there was a food that if I knew to avoid that, then that would resolve symptoms. Oh my God, I would avoid that so hard.
Yeah.
But that's not the case. I have a really significant issue with my skin. So it's a type of eczema that is just nasty. For years, it was uncontrolled. And I tried so hard to go through diets to fix it, to resolve it. Because allergy testing, you're not allergic to anything. Well, then you go to a naturopath and they're like, oh my God, it's corn. And so you're like, cool, I'm not gonna have any corn. Almost. Like I'm for sure exaggerating, but they give you a list, like a full coiled list of foods that you're like, you mustn't ever eat this. I followed this report to the T and nothing helped. And then I was like, oh, well, it's clearly dairy. Everyone says it's dairy. Oh, it's gluten. Everyone says it's gluten. Nothing. Yeah. Absolutely nothing changed a thing. So that's so frustrating.
I mean, I've had to do the elimination diet before too, and it was like they did the blood work and they were like, oh, these are all the foods you're sensitive to. You got to cut those out for a month. And I cut them out, and then they're like, and then we'll do a follow-up blood work. And then they did the follow-up blood work, and they're like, oh, these are all the foods you need to have more of. And it was all the foods that were off the first list. And I was like,
all of a sudden they're gone. Just like smoke. The signs. I can usually eat whatever I want, except if I'm in a flare. Some foods, just like
dairy, probably, right?
Dairy and like spicy Chinese food, takeout, ginger pork. I can't eat, which is just terrible because the only time I really crave it is when I know I can't physically tolerate it. Like maybe one piece of ginger pork. No, right. God. Like when you were first diagnosed, do you remember like how the medical professional explained that to you?
That's a good question. I've never been asked that before, and I honestly don't know. I don't remember. I remember the doctor who diagnosed me. She was lovely, and she still works at the Children's. And she's worked with my mom for 30 years. Okay. So she and my mom had a very good professional relationship. Mm-hmm. And then I would imagine it would have been a combination of her physician, nurse mom, telling me, but it's like burning yourself on the stove and then someone diagnosing me with a burn, right? You're like, yeah, I know. So when they kind of told me what it was, I was like, yeah, I know. I know, I get it. So I don't know. The diagnosis question is, yeah, I don't know. What did you guys think?
Well, it's interesting at 14 that you were like aware enough, or that you had the knowledge base to know what it was, kind of, because I was diagnosed at 29, and leading up to it, I met with a specialist, and she was like, it seems like colon cancer, but we won't find out for 3 months until we have your scope. So for 3 months, I thought I had colon cancer. And I didn't tell a single person, nobody in my family, because I was like, I'm going to scare the shit out of everybody if I tell them. So I just like kept it to myself. Then went for the scope, and then they like put you on fentanyl or whatever, and then afterwards they're like, oh, so you have ulcerative colitis. Here's a pamphlet. Here's your prescriptions. You got to go pick up these medications. Just take this stuff. Do the instructions. Meanwhile, like you're just coming off of fentanyl, so it's like, how do you really? You're not going to remember this. No. So like next day, I like had zero idea. I was like, yeah, I'm fine. And so it's like like you completely forget it. So at 29. I had zero idea what ulcerative colitis was, and like nothing really made sense to me. I was in a like stressful situation at that time too, so none of it really. I wasn't expecting that, and I was like, "Oh God, I have colon cancer."
Was that your first diagnosis of a chronic illness?
Yeah, at 29. So, yeah, it was interesting. What about you, Tim?
Yeah, mine was. I remember mine because it was just. I was 21. I think it was 2016. And I had, for like leading up to it, I was kind of in denial for like 4 months of just like, a lot of blood when I was going to the washroom. And I was like going to the washroom like 40, like no lie, like over 40 times a day. And I just like, eventually I was like, okay, it was one of those things where like, God dang, I'll go to the doctor. Like I'll go see what this is about. So I went to my doctor, my family doctor, and he's like, all right, I think you have hemorrhoids. So you're going to go in for this hemorrhoid banding procedure. I'm like, oh, like my mom Googled some stuff and she thinks it's like Crohn's or colitis, so like she thinks it's not that, but whatever. He's like, no, I think it's just this. So I go in for this procedure to get like whatever they do for that, and then doctor there is just like, yeah, you don't have hemorrhoids. Like, go back and see your doctor. And he gave me some like over the counter like anti-inflammatories. I was like, oh yeah, okay. I figured I didn't have that, but like thanks for this.
You'd know if you had hemorrhoids.
Yeah, right. Like, thanks for this super long journey of like just telling me something I knew. And then when I went back to my family doctor, he like sat me down. He's like, Tim, like I don't know how to tell you this, but you're disabled. And I was like,
it has like the weirdest.
Yeah,
sometimes
yeah. And I was like, what? He's like, your life will be relatively normal. And I was like, what are you? He's like, you have ulcerative colitis. They printed off some like WebMD description, like some like 7 pieces of paper, like gave it to me. And I was like, yeah, okay. Like, and I wasn't really. It was kind of a busy time in my life. I was the next day I was driving with my best friend. We were driving to Seattle to take this like U16 basketball team to Italy. So my first question was like, can I still go to Italy? He's like, when are you going? I'm like, next week. And then he's like, well, your premium will go up on your insurance if you do that. I'm like, but how much? He's like $15. I'm like, okay, well, I'm going to do it. He's like, okay, but here's my cell. And if like anything happens, like call me. And that was kind of my interaction. I was like, this is weird. And then he gave me this medication, but it was just like pretty much handheld, like a box of these like enemas.
The enemas.
Like a box. So on the whole way driving to Seattle, I'd like pit stop, fire in an enema. Yeah, it was a weird diagnosis. It was very non-fulfilling. I was like, I guess I'm...
Sounds a little bit like an SNL skit, the way that he presented it to you.
Yeah, I was kind of like, what? Like, I feel
you're
like
disabled and it's going to be relatively normal.
Yeah. But then I had other doctors and then I told me I'm not disabled. So it was so weird. I was like, I guess I'm not disabled now. Because you said so. Or I am, or I'm not. I'm in remission too, so things are good. Yeah. But it was just weird. It was a weird experience when I was younger too. I was like, I don't even know anything about sickness. I didn't know anyone who was sick. Mm-hmm. So, but then I was. But then I was like, whatever. I just want to stop going to the washroom.
Yeah. Yeah. So one of the main premises of our series here is to kind of get the male perspective on dealing with a chronic illness and trying to break down that stigma that comes with the territory. Because if we are to really look at it, the existence of toxic masculinity is huge. Mm-hmm. The idea of the way we're socialized when we're growing up to be a specific way because we are men, kind of keep our feelings for ourselves, not really be vulnerable and share those things. Did you have any kind of internal battle dealing with that you have to work on, or is that kind of something that's never really been an issue for you?
Yeah, a bit of a different take on it, because with my chronic illness, with my ulcerative colitis, I don't feel like I've had to address toxic masculinity or what it is to be a man, how to show up as a man with colitis as the lens. But being gay is very different, right? And I came out at the same time. My colitis was really poorly controlled. So I think that those two things, they're very much intertwined for me. And I think for my colitis and for my coming out, it was all just right there. So yes, very much so, yes. I've had to come to terms with what it means to be a man and recognize what society wants versus what I want. So it's hard to kind of untangle colitis and sexuality for this particular question. But I think stepping away and looking back for the past 8 years or so, yeah, you really do kind of pave your own path with how you show up as an individual. Mm-hmm. And then the masculinity portion of it kind of is almost like a side thought. I think that the more I focused on just being myself and walking my own path, the more I showed up as an authentic man, as an authentic person, recognizing that those two things are a part of life and maybe aren't a part of everyone's journey, but definitely are for me. And talking about that is important. It's really, really important to be candid and honest about all aspects, right? And again, untangling colitis and sexuality is hard because being honest about who you are is very important.
It's so true, because the thing is, you are being authentically yourself. And in my eyes, that is the true definition of being a man, is just being okay with being who you are rather than trying to fit the mold of what, society or what is expected of you. you accepted mistakes, you didn't want to do engineering, like you are fully confident in all of the things that you've done. And I think that that is a true testament to what we're trying to achieve here, is show what a real man is.
Cool. Yeah.
So, I mean, all three of us are in relationships. So I'm curious, like, how did you guys find dating after being diagnosed?
I have only seriously dated while in remission. So my take on this with colitis is pretty narrow. I can't really comment on that.
Yeah.
But I can tell you a great story about another chronic illness that's super relevant with my current relationship. So I'm with my partner now. We've been together for 4 years, and he and I met when life was smooth sailing. I was teaching yoga, living life at Lululemon. Everything was hunky-dory. We're doing good. And so we were together for, I think, a year and a half or 2 years. Yeah, a year and a half. And then my skin started going crazy, and my hair all fell out. In 1 month, I went, neither of you knew me when I was hairy, but I was same amount of hair. So
really,
all of my hair, all of my hair fell out. Yeah, not quite as juicy, but like
that's pretty
like
juicy
stubbly.
Okay.
Yeah, like no, like
this is pretty good.
It's a bit longer.
I shaved this morning. No,
liar.
I'm growing this for like a month.
So all my hair fell out in a month, and that, colitis, horrible. But that was the biggest thing that I've ever gone through that has rocked my identity and just like shook me. Yeah. Because, as a man, right? Hair.
Like a young man too.
Yeah, well, and 24, doing great things in life, and I felt like I was on top of the world, and then to have something so visibly wrong with you all of a sudden, and I had no eyebrows, I had no eyelashes, nothing, like zero hair. With my relationship, my guy is fantastic, right? And the fact that we went through that together, right? Like he met me and we fell in love and the whole thing when I looked completely different, right? Yeah. And then this crazy thing happens, and now you're on the other side of it, still with your partner. Yeah. But yeah, the fact that they can support you through something that is really challenging for your identity.
He's a keeper.
He's a keeper, yeah. Oh yeah, for sure. But yeah, losing all of your hair is hard.
It's like the external reverse of like the inverse of colitis. Colitis is like, it's hard to explain to people. It's very internal. It's very invisible. And losing all your hair in 1 month is kind of like the total flip.
It is the total flip. Yeah, it's a really good way to put it. Total flip.
Yeah. I will say you look great with a shaved head.
Thank you. Like it really looks well. Like I'm like, when I first met you, I was like, this works. Yeah, like, that's why you have it, because it works.
I just assumed so much. But I honestly, when I first met you, I thought it was just like a choice. Like a lot of people like to shave their heads, like some people like to shave their heads. Like I have a beard. Some people like to have their heads shaved and have a beard. Whatever. So yeah, I never thought of it as like anything other than like a choice. Yeah. Was this in relation to the colitis, like, or like an effect of medications, or like
no, it's just I've got a whole whack of weird autoimmune things. So colitis was my first thing, and then I have liver disease, which often goes hand in hand with colitis. So that's primary sclerosing cholangitis. That was my second one. And then eczema, but like wicked eczema. When you call it eczema, people think you have like a little scratchy patch.
My knuckles.
Like let me scratch my wrist. No, this shit's like, no. Yeah. So eczema and then alopecia. So it's just all related to being autoimmune.
Yeah. Right. So do you still struggle with the like intense eczema, or is it kind of under control these days?
It is under control because I'm on a fantastic medication. Yeah. But if I weren't on that, I would definitely not have that under control. So, yeah. very grateful for medications.
Yeah, and I was gonna say, being 14 years in this process, I'm sure you've seen a lot of different medications. So, what have been some of your experiences with medications?
Yeah, so I'm sure as you both, like you were on the Salifolk enemas by the sounds of it.
Yeah, hey, that's the.
This is Nurse Daniel, guys. Here we go.
Oh yeah, let's get it.
So started with enemas, and then I was on a tablet form of the same drug, like the 5-ASA. Acetol,
I hate that stuff.
They didn't do anything.
They work great for me.
Oh, what?
Yeah.
Oh my gosh.
I know. So
This is
the
why we have 3 people.
Yeah.
enemas, obviously, like steroids on steroids for a while. And then wasn't doing so hot for, 1920. So I went on Humira, which is often used for Crohn's, but not colitis. So I was on a trial of Humira to see if it was effective for colitis. I was on that for a year. Was super effective, but then lost efficacy. It didn't stop working. So then I went on Remicade, and everyone loves Remicade. So I will also say, I should have said this from the very get-go, that drugs and therapies are very individualized. So this is my story, but anecdotal evidence should not be taken as gospel. But my experience with Remicade was very negative. So I was on Remicade, had my first infusion, felt like pretty good, doing good after your infusion. You both know you're like, killing it.
Fresh.
You're zonked.
I'd be like out of it.
Yeah.
Really?
Yeah. Even with Entyvio, and Entyvio was working great for me, but it still like knocks me on my ass for a day or two.
Okay.
Yeah.
I walked out of there and it was great.
Yeah, I used to get like a infusion of cortisone before my infusion, and then I would feel like I'm gonna just go to the gym. Like I got this
Superman.
and eat everything.
Yeah.
My record is 70 pieces of sushi, but that was when I was on prednisone and was getting this, and it was just like a bottom. I only stopped eating. I ended up I just stopped eating because I was like, I'm just gonna I don't want to die. Like I don't know. I know it's you're not supposed to eat that
Dead
much.
by sushi.
Dead by sushi with a smile on his face.
But I had done week 0, week 2, and then I was visiting family in Winnipeg. And I was like, I feel dizzy. Like I feel like I'm drunk. And I told my mom, and she's like, okay, well, you look fine. You feel, everything looks okay. Nurse mom, right? Then I get home and I'm like, no, like I'm not, like something's weird. And I felt like I was tripping on things. Like it just didn't feel good at all. So I went to urgent care, and I very long story, kind of condensed quite a bit, but I ended up having about a dozen brain lesions. And one of them was like a golf ball that was sitting right on my like cerebellum, spinal cord, like right there, affecting my balance and everything. So then it's crazy, guys, but I lost vision in my left eye. So I had like nystagmus. Your eye does this uncontrollably. So I like literally couldn't see out of my left eye. It was just horrible. About 3 months. But I was hospitalized for a week, and then obviously off Remicade. And this is a known side effect, but like the 1 in 100,000 reaction that they're like, yeah, well, exactly. They're like, we don't even bother, man. This is on the pamphlet that you get.
By the way, brain lesion. Yeah.
So lucky me, I'm the one who gets the weird reaction. But after being in hospital for a week, and I was on steroids, so I'm sure that you guys have been on 50 milligrams of steroids, or maybe. Yeah, so
7 times in the last 3 years.
Yeah, so we all know, right? But I was on 1,500 milligrams of steroids for 5 days, and this was to try to stop those lesions from fucking me up. Yeah. But that 5-day course of steroids, I don't know how, I don't know why, it fully calmed my colitis down, and I was not too good with my colitis at that point. That is the last time I had a flare of colitis. But then coming out of hospital, I still was a little unsteady. I didn't have much balance, and my left eye was still all messy.
You didn't have a stroke, but you kind of...
It's demyelination. Okay. So if your head's full of wires, but they all have a coating on them. So none of them short circuit. but then these lesions were demyelination. So, you have billions of wires, but then on a couple spots, they all just cross circuit.
Yeah. Okay.
So freak out. That little chunk of your brain is just like, oh, what do I do? So couldn't see. 3 months, and then no, they remyelinate.
Oh, okay.
They can remyelinate, and luckily mine did. Yeah. So when this happened, they were like, okay, known side effect, sucks to be you. Mm-hmm. Also, this could be the start of MS. Sorry.
Yeah.
So the actual, and I didn't know this before, but the actual diagnosis of MS apparently is if you have 2 episodes of demyelination or 2 events. Mm-hmm. So this was my first event. So it can either be a single event demyelinating episode, mm-hmm. or it's the onset of MS. And so luckily, I don't have MS because I haven't had a second event. Yeah. And so the lesions have all fixed themselves, and now I'm all clear neurologically. But yeah, that was my last bout of like crazy colitis that ended in brain things, right?
Yeah, that's...
And since then, for colitis, I've been on like 5-ASA.
It's funny how because all 3 of us have had such different experiences.
Yeah.
It worked for you. It never 5-ASA and Salifac never worked for me.
Yeah, they didn't work for me.
Yeah.
Entyvio didn't work for me.
Oh, you did Entyvio before you did it?
Yeah, I tried Entyvio too.
I did it the opposite.
Yeah, and then when I was just in the hospital, I was in the hospital for about a month on my really bad flare or whatever.
After Entyvio or before Entyvio?
After Entyvio, I think I was just I think it's hard. You have to be such a good patient advocate for when you have a chronic illness that I wasn't even I was 21, in undergrad doing a Bachelor of Science. And I just couldn't really you explain things to your doctor in a way you're like, oh, they're totally going to get this. And then they give you their prescription for what your treatment's going to be. And in your head, you kind of think, I'm not a doctor, but this isn't going to work at all. You're putting a Band-Aid, when those infomercials where that guy slaps that tape on the water jug, that's it's well, bam, that's what you feel like they're doing, and you're like, that's not gonna work. So yeah, I got a really bad flare up, and he gave me this Entyvio thing. He's like, yeah, it usually takes about 6 months before you start getting effects. And that was my peak flare where I'm I used to be 210 pounds, and I was 140 pounds in this guy's office. And I'm like, wow, thanks for that. This is going to be great. 6 more months. But that didn't work. It didn't work in 3 weeks. And then I went back to see him, and he just yeah, go, you got to be in the hospital. And then in the hospital, they eventually put me on just a bunch of Remicade eventually. After that's another longer.
How quickly did the Remicade work for you? Remicade or Inflectra? I mean, Remicade in the hospital. And then they switched me to Inflectra later on after I got out. I had to read a bunch, go on Google Scholar, PubMed. I was like, I think we should try this. I think this is going to work. They were just we're just going to take out your colon. You're not going to get better. Mm-hmm. And I was like, no. We have to try this. Because I just needed that confirmation for myself to be I have to know I tried some kind of actual treatment before you just take out my colon. And he's like, I don't care what you do. Stay here as long as you want. Eventually you have to go home. But sure, we can try this and see how it goes. And I would have to I almost had to be no, I feel like I'm getting better. And just because I started saying that I felt like I was getting better, and I felt like a little bit was every day, they started to be oh, well then he's getting better. Mm-hmm. But if I was just take out my colon, or I feel crummy today, they would just triage me to surgery. Yeah. So it's crazy thinking sometimes your health can teeter on such a whether or not you're just going to say how you actually feel. Yeah. Coming back to what our first talk about, even your path in life, you say what you actually feel so people can objectively make a decision. Yeah. But it was really hard. Anyways, I got Remicade, and after Remicade, they switched me to the biosimilar Inflectra. I take that and azathioprine now. Yeah, it's crazy because you gave the disclaimer at the beginning of talking about medications about how it's so unique, or it's individual. It's for every individual, is so different. You started with Entyvio and it didn't work for you. Mm-hmm. I started with Inflectra, and that landed me in the hospital for a week. Yeah. And to the point where I couldn't even walk. I had zero feeling from my abdomen down.
Really?
Yeah. And I was in the ER for 4 hours, and they were really well, we're just going to give you another prescription for prednisone and send you home. And my partner Joel was no. I don't think that's gonna work. Like, you guys got to come up with something better than that, because they took an X-ray and they showed it to me too, and like your colon is like runs down like the left side of your cavity. Like, everybody knows, I'm sure, that's listening, but for those of you that don't, mine was about to rupture. It was like the Michelin Man. It like had moved over to this side of my chest cavity.
Toxic
like,
megacolon.
Huge, yeah. And they were like, it was like on the verge of rupturing. Yeah, and he was like, no, like, you're gonna give him prednisone and send him home when his colon looks like the Michelin Man? Like, no, like, do something better. So then they're like, okay. So then they just like put me in a room right away. They hooked me up to an IV of prednisone, and then I was there for a week, and then they switched me to Entyvio. And the funny thing is, like, for you, they talked to you about taking your colon out, and for me, they were like, no, we don't think we need to take your colon out. Like, there's so many other options before we get to that point. And like, it's so interesting, like, depending on the doctor and the circumstances, how different,
and how willing you are to say what you actually think. Like this isn't like, you when you're younger, you think it's like a very A, B, C, D, E, obviously my best interests are taken care of, but really it's like, oh man, long day yesterday, who we got in the caseload? Oh, 20-year-old, okay, this, well, do this. Oh, they don't want to? Huh? Yeah, sure, whatever, do what they want to do then.
That's terrifying. That's crazy that's the path of medicine, where if you don't have a little bit of advocacy in you, then you're completely at the mercy of whose ever decision it is.
Big life decisions.
Like for me, normally I'm like my biggest advocate, but at that point, 4 hours in, and I had like zero feeling, I was like, just give me whatever, send me home. It's like, I just want to sleep. Like, I don't care. I'm tired of wearing these scrubs or like this gown or whatever this is. And like, I'm managed by a nurse practitioner, and she's fantastic. But she sent me to a surgeon when I was completely well, and she was like, I just want you to have a chat with him and like have this as like a back pocket option, so that you can think about this now while you're well, so that you know that this could be a case that we eventually could go down. And at the time I was like, I'm not going to have the colostomy. But I'm really grateful that she sent me there when I was actually doing well, so that it was just more information, right? To have as much information as possible to make decisions. Yeah, exactly. It's a big decision. Holy shit. So to be able to sit and digest that, it was good.
I don't think our medical system, I guess, is very well set up for people with chronic conditions that need to be continually kind of managed, because usually it's kind of like, it depends on your condition.
There's also such a short period of time where a doctor sees you, like they allot such a short period of time that it's impossible to like fit everything into that like you need small appointment too. So like the fact that you were able to go talk to a surgeon and like get that information that you normally only get when you're really
about to sign the waiver. Sign this.
So like there just needs to be more opportunities for that education to exist for us, like in the process, not when we're like on a hospital bed.
Yeah. And I think having a point person or a point doctor, nurse, whatever, to discuss things with, for myself, like I had, like, it started off with a gastroenterologist, and then throw in a neurologist, and then a hepatologist for my liver thing, and then now I got a dermatologist too. So now I have this bunch of this team, right? Like everyone's just there and making decisions. Yeah, well, they're all over the different parts of the city, so you have to drive everywhere, and they all, they're good at communicating, but at the end of the day, right, like, okay, I have a skin issue, so I need to make an appointment with him, and then this, so I need to call them, and if I weren't on the ball, I can see how quickly and how easily chronic health patients can just slip. And then they need to be hospitalized, and that hospitalization costs $10,000 because, right? Like, if you aren't on the ball and advocating for yourself, you're doomed. There's no one that's going to do it for you.
No. And you don't really learn how unless you just kind of trial and error.
Exactly.
And sometimes people are nervous to speak up in those situations too, because they're like, oh, doctors know best. And it's like, yes, they do. They've had the education and they're brilliant. And no one's saying that doctors aren't brilliant, but the thing is, you know your body better than anyone. And like, sometimes that linear path that has been created doesn't work the same for everybody. So it's like understanding that just because what worked for you doesn't mean it's gonna work for me. And like,
you treat like the average, hypothetical
Exactly.
average, and then we all fall outside of that
Yeah.
to some degree.
It's like the bell curve with the outliers. Yeah.
But isn't it okay? So it's kind of ironic though, because that's literally what you're talking about being a man and just living your own life. But like everyone has their own journey with chronic health, and they're just their own journey. Period.
Yeah.
And there's a lot of tools to help you along the way. But at the end of the day, you do you.
Takes a supportive team, friends, the healthcare community, and then you still wearing the biggest hat of all, your own personal advocacy, making sure those people in your life, I think, are being a resource, not someone who's you're continually being like, well, what should I do now? Well, what should I do now? To like build up that self-efficacy, to be like, I can do me, and
also like taking inventory of like what's going on with your body, like, you know, some people food journal or whatever, but like also figuring out like the triggers. For me, like I know stress is like a huge thing. I know if I start like getting stressed out, that there's a good chance I could like wind up in a flare up or something like that, or something just negative. It may not always be a flare up. So it's always like taking note of what your body reacts to. It's not always just food. It's not always medication. Sometimes it's like an emotional state. Sometimes it's, you know, stress. So yeah, I think everyone just needs to pay attention to those things as well. Because like, again, with that linear path, we're not all going to fall under the same thing. I know for you, like like we talked earlier, you teach boxing and yoga, and music plays a really big part in your boxing. And, you know, Tim and I have both taken your boxing class. And
was it fire or what?
It was fire. You played zoo, and it was really hard, so it was good.
So how does music play a role in like your stress management?
I didn't realize how much I love music until I started teaching yoga and then now boxing. It was something that I enjoyed before, and like, oh, that's a good song, and you know, you appreciate music, but it's just kind of a part of life that kind of just happens exactly in the background. In terms of stress management, I can't even imagine what I would do now. And this sounds so just like, you know, it's grandeur and cliche, but I really don't know what I would do without music and just listening to a song and having that song create a complete experience. My flavor of music, which has kind of evolved with me as a fitness instructor, but also just as a person. You know, this music and life and whatever, but I love my music so much. And I'm not teaching as much at the moment right now with my nursing schedule, which is really a shame, but it's something that I looked forward to, like building my playlist for the upcoming week's classes. I looked forward to that. And it took me hours to make a good playlist, but getting your timing right and actually finding that one song that fit the vibe that you were trying to make is so satisfying.
So you said you made a playlist for us. Where are you sharing your playlist? Do you have
Spotify? I didn't realize I could share music on Spotify, but I figured out how I think I can do it. But I was really
link it in the
great.
Yeah, so that way if people
I was-
really can go listen.
I was pleased with myself though, because I kind of sorted it between looking back and just picking out the songs that were really like, oh yeah, I remember that one. That was a great tune. And then kind of filtering them again so that they're more fitting this conversation, right? Like resilience and the most fitting kind of tracks for the journey of chronic illness and mental health and, you know, all sorts of stuff. So you got some like casual tunes. Then near the end, I switched over to I started with some yoga. So that's probably about like half to 2/3. And the last bit is all like my boxing songs. So those are the tunes.
So you can give us a little bit of like a teaser on what artists we can expect on.
Yeah, for sure. You can expect a lot of Zoo. Gorgon City is another big one.
Really good.
Yeah, really good. But other than that, there isn't really a common artist throughout. I kind of put a lot of different people in there.
Cool.
Yeah.
Thanks for joining us today and like sharing so much with us.
That was my pleasure.
It's just been so comfortable like sitting around just like talking with you, and you're our first guest, our first official guest,
Inaugural.
which is but again, thank you so much, and we're so happy to have you. And
really enjoyed every second of it. So thanks for coming down on just a casual Tuesday.
Yeah.
And we'll be sharing Dan's playlist on Spotify, and we will also be sharing Dan's Instagram if anybody wants to check Dan out. And again, thanks everyone for tuning in, and thank you, Dan.
Gali Health is a precision medicine company on a mission to make sure nobody ever feels isolated, lost, or powerless in the face of existing or potential disease.
Gali is a free, well-informed friend and personalized mobile app that helps you learn about, track, and proactively manage your inflammatory bowel disease, as well as connect with others who have Crohn's disease or ulcerative colitis. Download the Gali app for iOS today in the Apple Store or Android in the Google Play Store.